Yes. Good morning, everyone. Firstly, I would like to thank the organizers for creating this magnificent event. I now notice how much I actually miss having like-minded people come together. Today I'm going to tell you a little bit about the significance of occupational healthcare. On Sint Maarten, it seems to be a fairly new concept, but it's not new in the rest of the world. It is something that we need to inform people about. Maybe something for a mini medical school day. What we need to do first, as a group together, is define occupational healthcare. I think everybody had an issue with this clip. Oh, okay. Occupational healthcare is dedicated to safeguarding the health and well-being of employees. In the end, you will see that safeguarding the health of employees will also mean that you have a healthy workforce, and therefore as 𝗔𝗰𝗰𝗲𝗀𝗀𝗀𝗏 will have more income coming in, hopefully, and also having less income going out when needing to pay for loss of wages when people are out on sick leave. It encompasses a wide range of health issues stemming not only from the workplace, but I should have added, also has an impact within the workplace, because people bring their medical conditions to work as well. Some of the examples are physical injuries and illnesses. We still see a lot of people who have accidents at the workplace which could have been avoided. Exposures, let's not forget, we just went through a pandemic where a lot of our healthcare workers were exposed to a virus. We also have ergonomic challenges, which is something that we haven't really looked at before on Sint Maarten, but it is something that impacts people in their long-term work, especially when you have someone with, for example, a hernia in the spine, and they don't have a proper chair to sit on. And then an employer asking, but they're out all the time. Could be solved with something as easy as a proper chair. My colleague in the back is probably going to explain a little bit more about that right after me. One of the big things as well is mental health. What I noticed in the past 5 years of doing occupational healthcare is that mental health is no longer a taboo. 5 years ago, people didn't want to discuss it. People came to the office being angry if I even asked the question if they were struggling with anything else than just a physical condition. And now I have people knocking on the door asking for assistance when it comes to mental health. Burnout, depression, but can also be socially related mental health issues, problems at home. And there's also, in that sense, a lot of social factors that we forget, especially employers forget. The employee has to come to work, but we forget that the employee also has a family, maybe elderly parents, maybe young children, and so on and so forth. Like I said, occupational health isn't new, but let me just take a moment to tell you guys a little bit about the historical roots. Even ancient civilizations had basic safety measures, right? When we still lived in the caves, we figured soon enough that it was smarter to build the fire in a certain corner and not in another corner, right? That's really where safety all started. In the Industrial Revolution, the 18th and 19th centuries, it prompted a need for more formalized safety regulations. There were a lot of deaths per year due to work-related incidents. In 1919, the International Labour Organization set international labor standards. In 1970, we had OSHA in the United States that was created due to an alarming number of hazards and injuries. And then in 1998, the Dutch started the Working Conditions Act, which was revised in 2007. On our sister islands, the former Dutch Antilles Islands, we've had occupational health providers for more than 20 years. So not necessarily new to our region, just sort of new to Sint Maarten. But it being new to Sint Maarten has its reasons. We have to take into account a changing world of work, especially here as well, where not only work is changing, we are becoming more modern, we're looking towards the future, but also our labor legislation changes. A year ago, most recently. We have to consider also that the modern workplace has an impact on human beings. Some of us behind computers sit more hours than we ever did before. We heard sitting is bad for us. But there are also more demand on the workload. Yes, we all hear more and more people with the burnouts and things like that coming up. And don't forget that there are also fluid workplaces nowadays, even SFV is doing that. Working from home, digital nomads, who is then responsible for that employee's health when they are not necessarily in the office or at your workplace? Those are things to consider as we head into the future. So why does occupational health care matter? Like I said, it protects the worker health and safety by reducing workplace accidents and illnesses, which enhances productivity and job satisfaction. The goal on Sint Maarten is to have employees maintain employment with their illnesses, limitations, and so on and so forth. Because there's no plan B. It's not like in the Netherlands when after 2 years you cannot work anymore, your salary is subsidized, and you continue living happy with your disability except you don't have to work anymore. Here, after 2 years, as it fees, at least coverage of your salary stops. Most employers then also choose to end employment. And then there's, I think, correct me if I'm wrong, a few hundred guilders that you might get from government afterwards. So the goal for the occupational health providers is to assist people in maintaining employment. And we do that not only by having the occupational health physician taking care of someone. Dr. Tan said we needed to go into a more, a team around a person. That's where the collaboration comes in with other specialists, and hopefully someday also systems that speak to each other so that we have everyone's information. So it's not only the physical therapists, but also mental health professionals, ergotherapy in the back, social workers, and reintegration coaches that all work together to help people, again, maintain employment. What we do there is not only describe what someone cannot do, but more importantly, all the things someone can do. And I think that is where we can win, where employees have a better understanding. Because we can say, oh, this person can work 4 hours a day. But doing what in those 4 hours a day, right? Where can an employer still place someone so that they can be productive? That's the question that we try to answer. That, of course, does bring some challenges. While the importance of occupational health care, I find, is indisputable, we do have some things that we need to work on still. So challenges include limited resources. On Sint Maarten, it is still the employer who chooses if they ask for the assistance of a occupational health provider. It depends on their budget if they can pay for such services. And, of course, ensuring employer and employee compliance. You're not the only one struggling with that, Mr. 𝗗𝗏. I've had people that the advice is given that they should not be doing their work because whatever medical condition they have comes with great risk while they're at work. And then I hear that they go anyway, right? And then they hurt themselves, and then they come back. But I also have employers that get advice of certain changes or adjustments that they need to make for someone, and they choose not to. So compliance is something that we really struggle with. And the limited awareness and understanding of what occupational health is. On Sint Maarten, we still very often hear MedWork is there to fire people. If your employer wants to fire you, they do not need MedWork. Because I tell all employers, if you do make use of an occupational health provider, you have to make sure that you understand that it means that you are doing things for the best of the employee. Yes, it's not the other way around. And all of that, for today as well, we were here together because we were discussing the future, right? 5-year plan. So navigating tomorrow, and it's an evolving landscape, as we also heard from Dr. Tan. Every single time they come up with a great plan, the plan needs to be adjusted because circumstances change. Like, for example, technological advancements. We have people with integrated wearables. One of the things that we also struggled with is for those people who work from home, those very nice devices that keep the mouse moving. And we all think they're working, but they're not, right? So that's something to consider. And how we can use telemedicine is something that would be beneficial, especially in an occupational health setting. Because you could have someone stay at work while talking to their psychologist for an hour about how they can manage their burnout without anyone having to leave the office and spending time and so on and so forth that side. We need to change towards more data-driven decision-making. On Sint Maarten, unfortunately, we have almost no data about the actual sick leave percentage. SZV, of course, has data from day 3 onwards, but nobody has data from day 1 and 2. And that has to do with all employers were either registering it or not registering, or they registered it in Excel and they lost the file, or the house doctors were not actually registering how many cards they were signing. Assistants were signing in the front and giving cards back. Back in the day when we had yellow cards. Now that people don't need to go to the house doctor anymore, there is hardly any data about the actual number of sick leave on the island. We do know that it's probably higher than on our sister islands. But that's just a gut feeling. We need to focus more on mental health, like I think a lot of people have mentioned already. Also consider the globalization and diverse workforces. A question on my table is moratorium in healthcare. Maybe that's something to consider if we want to have a more globalized workforce. We have to focus also way more on resilience and preparedness, especially for health crises and emergencies. We live in the hurricane belt. We should have better things in plan for when such a crisis happens again, where you have an entire workforce, an entire island, who cannot provide labor for 2 or 3 weeks like we had with 𝗗𝗿. We should focus way more on prevention, but that's something that was discussed already, I think. Let's see if I have anything else. Yes, the collaboration across specialties. I think that's an important one to still have a moment and talk about. I do notice that more and more specialties are aware of occupational health, specialists especially. It's something that we could definitely focus on and have a more open discussion about, because sometimes we would like to assist someone to head back to work, let's say someone who's an amputee, but we don't understand exactly what kind of amputation it was, or if there's a flap, or what the ending of the bone is, things like that. And then having that communication with the orthopedic surgeon is essential. Employee engagement is something that we could also really work on. Empowering workers to manage their well-being actively. Now we're at a point where the employer makes decisions with regards to what services are offered in occupational healthcare. So they buy the package, but it could be an idea to first ask the employees, what do you need? And then build your package on that, which would be way more cost effective than doing it the other way around. And also, we heard about the environmental sustainability, where we need to have sustainable and worker health considerations as well. if we do have a hospital that is going to be underwater, we need to consider those things going into the future. In conclusion, occupational healthcare is not just a responsibility, it is our commitment to safeguarding worker health and safety so that we can have a resilient Sint Maarten going forward. Thank you very much.